Welcome everyone to today's Zoom session. We're going to be looking at catheter care and troubleshooting, and it's going to be given by Katie Stewart, and this is her first time using this, so be gentle.
Thank you very much, Ivan. Good afternoon, everybody, and welcome to this session Finding Catheter Care. My name is Katie Stewart, and I am a student district nurse at Springfield Medical Centre in Arbroath. So today this session will be surrounding catheter care with some useful information to support you looking after patients with catheters in situ. Okay, so we've got a couple of learning outcomes.
Can everyone see the learning outcomes?
Yes.
Yeah.
Okay. Oh, got one slide too far, Ivan. There we go. So from our presentation today, we are hoping that you will have a better understanding of what catheters are and why we use them. Also, the different types of devices we use for securing catheters. So there's a couple of examples there for you. And then we're looking at some of the common problems that we find as district nurses for call-outs for catheters. And then we've also got just a small slide at the end just surrounding catheter passports, which are quite new in the community setting, and I'm sure you'll start to see them become more widely used. So this photograph is a catheter with the balloon inflated. So that balloon holds 10 mils of water. And what you can see at the top is a small eye, and that's where the urine drains through into the leg bag. So from that photo you can see it's quite a substantial balloon that's keeping that catheter in the bladder. So moving on to our next slide. There we go. So what are catheters and why do we use them? So catheters are a flexible tube which has a balloon at the end which keeps the catheter within the bladder, and it facilitates the passing of urine into a drainage bag. Catheters can be used for a variety of different reasons, including retention of urine, which is when you're unable to pass urine. A lot of spinal patients will have catheters in situ. Also patients who perhaps have cancer of the urinary tract in the bladder. Sometimes other cancers can also have catheters in situ. There could be obstruction issues such as enlarged prostates within men, and you also get bladder stones which can be either men or women. And they can also be used when patients are in the latter stages of their life and in end of life care, which can just alleviate some of their symptoms. As a rule, catheters are changed every 6 to 12 weeks, depending on the reason why they're in. And catheter leg bags should be changed weekly as routine. However, if you do have problems such as soiling, it's perfectly fine to change them sooner. So going on to securing devices. So it's essential when patients have catheters in, they're safely secured to the leg, as this can aid in preventing any problems. So there's a variety of devices which can be used, and I'm sure you've possibly seen a variety being used within the setting of your patients. The most common ones that district nurses would be using would be the leg strap, so they attach at the top and the bottom of the catheter leg bag. You've got the catheter strap, or some people know it as a G-strap, and that attaches around the thigh and provides securement where the catheter attaches to the leg bag. There's also aqua sleeves, which are a netting bag, and they come in different widths depending on the size of the patient's leg. And that's a netting bag that's worn just over the knee area and helps to keep the leg bag safe and secure on the leg. And that can also be used with some leg straps as well, normally at the top, just to help keep that in place. And normally the securing devices are sourced through district nurses. We can arrange for that to go into a patient's repeat prescriptions, and if any adjustments need to be made, if you certainly liaise with your district nurses, they should be able to signpost you in the right direction.
So the aqua sleeve measuring, that should be done by the staff, and that would indicate what size they would need to get.
Yeah, they come in different sizes due to the patient's leg width. So you might have some frailer old ladies who've perhaps got a thinner leg, so you'd be looking for a smaller size for them. And then people who've perhaps got a larger leg circumference is perhaps the word I'm looking for, who'd need a bigger size.
Okay, no problem.
So when we're using these securing devices, it's important we're keeping a good eye on them. So we're just watching that we're not applying them too tight, as this can cause trauma to the skin. Also, the leg straps that are used, they can be cut to size. and also monitoring the skin surrounding the securing devices for any signs of irritation such as redness. So we're now moving on to some photographs. So this one is of a patient who has got leg straps for securing their catheter. So we can see that it's attached just one above the knee and one below the knee, making sure the catheter is off the ground so that we're not giving any port of infection. Both these examples are both quite bad practice, and it's something we definitely don't want to be seeing out there when we're out visiting patients. So the top one, the leg straps, are unfortunately positioned the wrong way, so it's over the top, so that would obstruct the flow of urine down into the bag. And on the second one, this has been tied onto the patient's leg, which is a big no-no, as that can cause loads of skin issues and can also cause some really nasty hematomas we've seen with a patient once with this. And can also say in both photographs, this catheter bag is far too full. So just to note that as well, that we're definitely not looking for it to be bulging. So our next one is the G-strap in situ. Most of us refer to it as a G-strap, but some people call it catheter strap, so it's completely your choice what you want to call it. And what it does, it provides a wee bit more security where the catheter and leg bag attach. So what we're looking for is that's going behind the catheter tubing and then securing onto the leg. Most folk within my practice, they normally use a G-strap with leg straps just for that wee bit added security. But to be honest, I think it's a really effective device to be used and can help pull in the catheter as well.
Does everyone get those as standard now, the G-straps?
No. We've got one for that. Yeah, we've got one. We have one, yeah.
But we don't get them as standard. So it's perhaps worth asking the district nurses if they could supply them, because that would make it a little bit more secure. And they should be able to get you those onto repeat prescription. Okay? Okay, we'll move on.
So our next photographs, this is how not to apply the G-strap. So when that little tab is just going over the top of the catheter, that is not securing anything. And that is not how it's supposed to be used. So we're really looking for it to be looped behind that catheter and secured tightly to the leg.
As in that one. Oh yeah, you can see the difference, can't you? Yes, quite clearly. There's a difference.
Yeah.
Okay.
They're handy to have. Okay, so this shows the aqua sleeve in use. So what we can do with them is, as I've already said, they come in different diameters for different leg sizes. Can be used in combination with the G-strap, and as you can see in the second photograph on the right, that's how you can also use it with one leg strap at the top, just for that wee bit added security if you need it.
That's very secure, isn't it?
Yeah, yeah.
That's going nowhere.
Absolutely not.
Yeah, that would be much better.
What was that?
I like the fact that it was really secure with the leg strap as well.
Yeah.
Yeah. And that's what we're trying to do. We're trying to keep it nice and secure so we're not going to hit any problems.
Yeah.
So if we're just moving on to our next slide, so this is just surrounding the regular draining of the leg bags. So most leg bags will hold between 400 and 750 mils of urine. So it's essential that we don't allow these to become more than 3/4 full, as this can cause pulling and can also cause quite a lot of pain for the patient. So the photograph on the left, that's good practice. So I think that one's got about 200 mils roughly in the bag. Whereas the photographs, both the middle one and the one on the far right, both show when that leg bag's really quite full, the amount of pressure that has pulling down onto the bladder.
I thought that, I know I'm obviously being thick, because I was under the illusion that if it was open too much, you were causing, you could cause infection.
All right, so what you're saying is that opening it too much could be a cause for infection. So you're trying to get that balance right between opening it too much, but making sure that it's emptied regularly.
Yeah.
Yeah. I think what your guide is if it's beginning to pull, that's when you should start to sort of think about emptying.
So I personally wouldn't have thought that 250 was enough to empty.
I think once you're sort of getting above that 250 mils, it is beginning to become quite a weight that the patient can feel pulling down.
Mm-hmm. Right.
If it's well secured, That shouldn't be a problem, should it?
That's what I was thinking. If it's really secure, leg strap, G-strap, and the stocking.
Yeah, so if you go for about 3/4 full and it's really secure, that should be fine.
Right,
if it's not very secure, then you have to think about another option.
Right, okay.
Does that make sense?
Yep.
Yep.
And what we're doing as well, by emptying the leg bag regularly, you're seeing how your patients are drinking. So if your leg bag becomes quite concentrated, so that's when the urine becomes quite dark, it's that first alarm bell to you to think, oh jings, we're maybe needing to increase the fluid intake for this patient. So what we're always looking for is quite a pale yellow colour where we can.
Can I just clarify, you don't empty the leg bag completely, do you? You always leave a small amount of urine in the leg bag, is that right?
I would always empty it completely if it was me.
All right, okay. Because I have read some literature that says it can cause a vacuum or something.
Not as far as within our clinical practice. I wouldn't say that was something we'd be adhering to. At least if you empty it completely, you're getting an accurate volume of what they're passing.
Yeah, because it's not. I don't think that's a vacuum in itself. Does that make sense, Levine?
Yeah.
Okay, we'll carry on then.
Okay, so our next photo is just about catheter positioning. So catheters should always be kept straight and draining in a downwards direction. And I know that's quite an obvious statement to make, but urine does not flow upwards. So if we can make sure we're always draining in a downward position, it'd be fantastic. And on to our next slide. So this is about night bag attachment. So obviously your night bag's normally used in the overnight period. And this is a larger bag, so it attaches onto the bottom of a leg bag in the overnight period. So normally goes on when your patients are going to bed and then comes off in the morning. And that contains a larger volume of urine. Some patients do tend to pass a larger volume of urine overnight. Night bags attach onto the bottom valve of the catheter and where possible should always be on a stand, but I appreciate that can sometimes be tricky to source a stand. So in a bucket or a wash basin is perfectly fine, just one of the disposable ones. And you can see from the photographs, the first one on the left, so that's where we're attaching the night bag onto the leg bag. The middle one shows the night bag attached on and draining. And our end one, that's a catheter night bag on a stand. So I'm sure most of you have seen that prior to this presentation. So we also find out in practice is catheter valves. And the valves can be used to help in retraining the bladder. Valves improve your bladder capacity and also the tone of your bladder. So this can be used sometimes prior to catheters being removed to try and train your bladder back into a normal toileting regime. The catheter valve should be emptied regularly, just like you would normally go to the toilet throughout the day, so about 4 or 5 times daily. And they are emptied through going to the toilet and opening the valve, and that allows the urine to drain, and then closing off that valve again when the urine drainage is complete. So this is some photographs of, this is what's called a T-tap valve. So the first photo just shows how we're attaching that onto the catheter. The second one shows when the valve is open, so the urine would be draining through at this point. And the end one shows when the valve is closed. And what I'd also like to say at the end of this slide is you also get what's called a flip flow valve. So this is one that you would move the valve downwards to empty and just empty it, the urine from your bladder, and then you move it back upwards again to close it. Unfortunately, I didn't have any to take a photograph of, but you might also see that kind of valve on the bottom of a leg bag as well. So it might be something you have seen out in practice. So moving on to some common problems with catheters. So these are the things that tend to be the common themes when you're getting call-outs as district nurses. So bypassing, so this is when urine is leaking past the catheter tube. It's usually caused by positioning of the catheter, and what will happen is the patient will become wet. So normally if it's bypassing, it's important to check the position of the catheter, that it's not kinked or anything, and also the position of the patient, that they're not sitting on the tube, and that's what's blocking the flow of urine. We've also got hanging catheters, so this can cause trauma or bypassing, and normally occurs when the catheter is pulled. So sometimes if it's not secure on the leg, that can happen, Also, if the leg bag is too full, that can also cause the catheter to hang and cause problems. Hematuria, so you'll sometimes phone me and say we've got some blood in the urine. So we'll come out to that, and that can be a source of infection perhaps being caused, or quite frequently had one this morning where it was an elderly gentleman and he'd had a wee pull on the catheter and caused a wee bit trauma. So normally we come and just make sure it's not too frank blood, so that would be the fresh blood coming, and normally a district nurse would come out and see that. Catheters being pulled out, to be honest, sometimes we will have demented patients and they do pull them out. Sometimes that might need reviewed and there might be an alternative method of keeping this patient continent. That can also be caused sometimes due to the catheter being poorly secured to the leg. Blockages are also a really common problem we have with catheters. This can be caused by debris in the bladder, so there is little bits of debris in the bladder that can come into that little eye at the top of the catheter and block it off, and then that can cause some bypassing also. As I've previously alluded to, things like kinking or twisting of the leg bag or the catheter tube can cause bypassing also and stop the direct flow of urine. It's also really important for patients with catheters that we make sure they're drinking nice and regularly. So in this hot weather, we'd probably be looking around the 2 litres a day where possible, and just making sure that the leg bags are being emptied regularly, so that's not a contributing factor. So another important area is infection control. So when you've got catheters in, you are at an increased chance of infection, so it's important that we have good hand hygiene for both the patient and the staff member carrying out the task. So as I'm sure you're all aware of, the 5 moments of hand hygiene is the best practice, and that's from the World Health Organization. And I'm sure a lot of you have seen the poster that's got the 5 moments that we'd be looking for. Also making sure we're using our personal protective equipment, so our gloves and our pinnies, and making sure we're doing our hand hygiene prior to the task and afterwards. Catheter care, so that's also important on the patient side of things. So that should be carried out daily, including cleaning around the urethra, so that can be that's where the catheter exits the body. And it's important with that we're keeping it clean, as that can also be a port of infection. And if patients have got a catheter passport in at the moment, you can see that on page 4 of the catheter passport.
Has everyone seen the catheter passport now?
No.
If you haven't, it's worth asking one of your district nurses if they can bring in a copy for you to have as reference for all of this stuff. It's a useful thing to have. So just ask your local district nurses if they can bring you in a spare one. They won't mind.
I think as well, the district nurses, it's quite a new document for us at the moment as well. So really, you should be starting to see, as patients are routinely getting their catheters changed now, you should start to see more and more coming out for those patients. So just alluding to the NICE guidelines, so this is the National Institute for Clinical Excellence, and they emphasise that to prevent catheter-associated urinary tract infections, the importance of regularly emptying that catheter, making sure it's positioned below the bladder so it's a nice downward flow of urine and that's not touching the floor, as bugs can crawl up the end of the leg bag tube, and that's definitely not what we want. And just a wee extra point on there is, if a patient is starting antibiotics for a urinary tract infection, then it's important that we get the district nurses in to recatheterise that patient within 24 hours. So if that was in the out of hours period, say 2 o'clock in the morning, that's perfectly fine to wait until the district nurses start the morning, and then they would come out and kindly recatheterise.
Yeah. On the bit about infections, don't forget that last year we were informed by the infection control pharmacists and people like that there was no point in dipsticking catheter samples of urine. They had to be taken not from without the bag but from the portal, and that you need to follow those guidelines to be able to test a sample of urine from a catheter.
Well, this is our penultimate slide, everybody. I'm sure you'll be glad to hear. So this is a photograph of the catheter passport. So this is what all your residents with catheters in will be transitioning on. So this is a new document that's to stay with the patient. And this is a document that will provide lots of information for both the nurses and the carers surrounding catheter care, the drainage system the patient's using, and the current treatment plan that that patient is having. So that will be the size of catheter they're using, as well as a bladder washout, which is always useful information sort of in the evening period and the overnight period for district nurses visiting. The document is transferable, so it works across both health and social care. And if a resident is to be admitted to hospital, it's important we get this document to go in with them.
And it's important that it returns with the person.
Where possible.
So if it goes into 9 wells, it should come out of 9 wells.
Well, that's the plan anyway. So that concludes my presentation for this afternoon. Thank you everybody for listening in, and I hope it's been of use to you. There's a couple of references there on the back of the slides if anybody wanted to do any further reading.
I'm going to just pause the recording, and then I'm going to ask you a few more questions.